With that, questions for me or the Secretary?
As you pointed out, Massachusetts is a national leader in vaccination. So do you think that we would be back here, and where did we go wrong?
Well, I don't think anybody went wrong. As I said, I think Massachusetts, more than most, has done almost all the things that make sense to protect themselves and their communities over the course of the pandemic. But as we've all noted, the virus has gone through a series of changes and variants over the course of the past 2 years, which has absolutely changed along the way the game plan that we and others have employed to support our communities and to keep our people safe.
Governor, by putting out the advisory to say regardless of vaccination status, you can mask up, this indication that obviously more needs to be done. Why stop short than a mandate, even if there's a recognition that there needs to be an increase in masking? People should, more people should be masking.
Well, we are saying that we think more people should be masking, but people in Massachusetts know at this point that masking is one of the tools they can pursue if they choose to do so to protect themselves. But let's not forget, 5 million people in Massachusetts are fully vaccinated, and the vaccines are by far the most effective tool we have in the toolbox to protect one another from COVID.
Do you have the power to issue a mask mandate, or do you need to declare another state of emergency to be able to do it? I mean, is it in your power to order a mandate right now?
I have no interest in putting a mandate on this issue, given all the tools that are available on a statewide basis on the people of Massachusetts. If locals wish to pursue alternative options, they can do so. We issued a mask mandate last fall because we had no other options available to us. At this point in time, we have vaccines, we have rapid tests, we have our testing sites, and people know a lot more about what works and what doesn't with respect to combating the virus. And if people wish to add an extra layer of protection by wearing a mask in indoor settings, we would urge them to do so, especially when we have cases rising across the Commonwealth.
What about schools? Is there any possibility that they could shut down again? Will changes have to be made after students return after the break coming up? And what will the mask policy be for schools? Or I guess is there any?
Well, DESE has a mask policy in place at this point in time, which they continue to discuss with their colleagues in local government and with leaders in the medical community. My view on this one's really simple. Kids need to be in school. School is safe. It's not only safe, it's healthy. There's an overwhelming amount of evidence out there at this point in time that keeping kids out of school, keeping them away from one another, keeping them away from trained and caring adults did terrible damage to kids all over the country. It's not going to happen in Massachusetts.
Governor, are you able to give an updated number on the number of cases of Omicron in the state at this time?
We follow, for the most part, the cases in total that we process every day. There are many people sequencing these cases. I think what the fair thing to say is Omicron is clearly going to become the most significant variant here in Massachusetts, if it's not already soon.
Do you plan on issuing Omicron-specific numbers?
We've never issued Delta-specific numbers. I don't know why we would do that with Omicron.
Only the first cases. Yeah.
Only the first cases? Okay.
Governor,
Do you see any different field hospitals at all coming back?
Do you want to talk about how the Guard's going to assist hospitals in this one?
So what we're pursuing with our hospitals is by providing, think of it as like giving hospitals the tools to expand, to maintain and expand capacity within their own footprint. We've lost 500 acute care beds in Massachusetts because of staffing shortages. So by providing the non-medical side of the core, will hopefully allow them the capacity, the ability to open up additional beds. The challenge with field hospitals right now across the country is the staffing shortages.
And the sites.
And the sites.
So I can already see the comments online. How do you respond to people who say the staffing shortages are due in part, of course, people leaving the workforce, but also because of vaccine mandates? How do you respond to people who say if there wasn't a vaccine mandate for hospitals or clinics, there wouldn't be the staffing shortage, we wouldn't need the National Guard? How do you respond to, again, those comments like this one already imagined saying?
I would argue, I mean, based on the conversations you and I have had with the hospital community generally, I think they would say that the staffing shortages are something that started before anybody was putting mandates in place. And the two other things I would say, and these are really important, a staff member who gets sick can't work. A staff member who stays healthy can work. And more than anything, we need our colleagues and our friends and our neighbors who work in the healthcare community to be safe and healthy because of the work they do, not just with COVID people, but in general, throughout the course of this particular time of year, which has always been, as far back as I can remember, a point in time when you see significant more traffic in our hospitals than you would see at other times of the year.
Governor, to clarify the National Guard, 300 are training this week to be deployed Monday. Why, then when will the other 200, you say up to 500, when will the other 200?
Part of that depends on what we hear from the hospitals, but you can speak to it if you want.
So the today's order of up to 500 includes the immediate 300 for hospitals and ambulance companies. It also acknowledges the other about 80, 85 that are currently deployed for school testing and other testing support. Command center staff, so the Guard has to bring in staff, the administrative staff, to actually manage the deployment of the 300 plus, and then just literally like an extra amount to deploy as we need. So it's 380 to 85 that are already deployed or part of this order. The staff that the Guard needs to just administer the program of deploying 300 people across hospitals and managing them, plus the 12 ambulance companies, and then literally just having like an extra amount if we need to further deploy.
Would that be like 100?
Yeah, right. So 300, 385 plus another probably 50 to just manage the whole logistics, and then so that's probably another. All right, somebody else can do the math. So the training happens by both the Guard and the hospitals. So they'll have basic CPR training, basic EMS training, and then the hospitals will do their own internal training for the particular role that they have.
Governor, the holidays are a time everyone looks forward to getting together. Many people feel like they've already missed out on a couple years of spending time with family and friends. How do you stress the importance of getting that test ahead of time, and then if you do test positive, to quarantine and maybe remove yourself from the situation?
So one of the main reasons we went outside the traditional procurement routes to make a deal with a single test provider and to bring 2 million tests here to Massachusetts, to many of our hardest hit communities, was because we wanted those rapid tests to be available in those communities to help people stay safe and to test themselves before and after they involve themselves in gatherings. And part of the reason we wrote a contract with a number of these testing organizations to make it possible for cities and towns to start buying off that contract and using some of their federal money to do so was to enhance and continue to replenish the testing supply that's available in communities around the Commonwealth, to go along with the 100 sites we have that currently do about 100,000 tests a day, and to go along with all the tests that people might be able to find at a retail level or to purchase online. I think it's part of the reason why the president's talking about a major test purchase on the part of the federal government as well, because this is in many ways one of the best ways people can test themselves and those they would gather with to be confident and comfortable that they can have a safe holiday gathering. And it's for many reasons, including the one you spoke to, which is the fact that for so many people, these events have either been canceled, postponed, or dramatically altered over the course of the past couple of years, that we really want people, especially those who are vaccinated and especially those who take advantage of these tests, to be able to gather with confidence that they can gather safely with the people that they love.
There's been such a high demand for tests, especially with the holidays coming up. Is there any plan to expand testing sites in Massachusetts and increase availability in any way?
Well, as I said, we're doing about 100,000 tests in our own sites. We put 2 million tests out into communities, mostly those communities that were hardest hit by COVID in the first place. We're going to continue to make it possible for people to buy off those blankets on a go-forward basis. And we're going to do everything we can to make as much testing capability as available as we can. We get the fact that at this time of year there's going to be heavy demand on them, which means people may have to be patient and to wait. But that testing capacity is a critical piece, we believe, of our strategy to help people stay safe.
Governor,
Last
you
question.
approve of the plan Mayor Wu rolled out yesterday to require vaccinations in public places?
Well, we said many times that we believe it's critically important for us to work with our colleagues in local government on whatever initiatives they pursue that they think will be most helpful to them and their communities. What I would say is that if there are ways in which we can support the city of Boston, I mean, they were a big winner on the vaccine rollout, or excuse me, on the testing rollout. They got almost 500,000 rapid tests from us. We'll certainly work with them and any other community on any initiative where we can be helpful.
That is the kind of step that you would approve of the municipality taking.
I don't want to get into a business of telling municipalities what to do and what not to do, okay? What I want to do is be here to help them if they seek our help on initiatives that they pursue.
Is the decision to shut down those non-essential surgeries at a hospital a proactive move by the state, or is that something that the hospitals they were asking the state to shut them down?
You should, I mean, I would argue that this is an iterative conversation that's been going on with them for 2 years, basically. But do you want to speak to that in particular?
So we've been meeting with the hospitals, it was daily during the early days of the pandemic, and it continues on a weekly basis. We've had a lot of back and forth around the acute care staffing shortages that exist in the hospitals, and put on a series of items that we went back and forth together. The Hospital Association put on a number of items, we put on a number of items, and literally everything from the ICU nurse staffing flexibilities to using alternative space for procedures and the like, to the non-essential electives, and allowing also for individual hospitals, if they maintain 15% of capacity, right, they would be allowed to continue the electives. So it's really been a very iterative process back and forth with the Hospital Association.
Thanks, everybody.